Radiology was born on the 8th of November in 1895 in a laboratory in central Germany. Wilhelm Röntgen, the head of the physics department at the University of Würzburg, was working late in his laboratory when he decided to cover a Crookes tube with black paper and investigate the fate of the beam generated by the anode in the tube. When running through his experiment, Röntgen suddenly saw something astonishing. A barium plate that was accidentally placed on the table started glowing. He thought he was hallucinating. How could the beam in the tube go through the black paper? Röntgen locked himself in his laboratory for the next 7 weeks and laboriously placed various objects around the tube to see which ones allowed the beam to pass through and which ones blocked it. At a certain point, he decided to hold up a plug of metal and saw the bones of his own hand. Röntgen thought he was going mad, so he brought his wife into the laboratory and exposed her hand to the beam. She was mortified and proceeded to tell him, "I have seen my death." Röntgen eventually published his findings, which earned him the first Nobel Prize in Physics. From then on, X-rays became an indispensable tool, which finally materialized one of mankind's earliest fantasies, the transparent human.
Computed tomography or CT scans and computed axial tomography or CAT scans are popular 3D imaging techniques that can image tumors and other body abnormalities. CT scans are non-invasive and help show tumor shape, size, and location, all without having to cut into the patient. X-ray emitters send X-ray waves which pass through the patient's bodies and bounce off digital detectors on the other side. The emitters and detectors are placed at several different angles, producing multiple views of the same area. These images are combined together through the use of mathematical formulas and produce a clear 3D image of the patient.
PET scans, also known as positron emission tomography, is utilized to pinpoint where specific abnormalities take place. PET scan is a great marvel of quantum mechanics that uses antimatter. Radioactive materials emit positron, which come into contact with electrons in the body and cause annihilation. Annihilation creates energy that travel in a straight line away from each other. The detection of photons can pinpoint where exactly the radioactive tracer is. Radioactive glucose analogs are used to track glucose metabolic activity in the brain. Yellow, green, blue represent hypometabolism. Orange, red represent hypermetabolism.
To find out about the fundamental principles and the current state of MRI, we went to talk to Dr. Ben Ellingston, professor of radiology at the David Geffen School of Medicine.
MRI uses the principles of nuclear magnetic resonance, and in particular, in most clinical applications, we're looking at water, the protons on water specifically. So, kind of in a nutshell, what happens is protons have this magnetic moment associated with them, and when they're put into a static magnetic field, they precess or rotate or spin. And we use radio frequency that's tuned to that resonant frequency or that natural spinning of the protons, which corresponds to whatever magnetic field that they're in, to excite or perturb their spin characteristics. And depending on the tissue characteristics, depending on how dense it is, how much water, and the interactions with other types of molecules, we get different, or the amount of energy that's after we excite those protons, the amount of energy that's emitted and the timing that it's emitted tells us information about the interactions of those protons with the environment. And so we use a combination of magnetic field gradients as well as a static magnetic field to isolate where these contrasts are coming from in terms of a pixel or a voxel or location within the body, and that's kind of the basic principles behind it. And we use a variety of different image contrasts and exogenous contrast agents that we inject into the body to elicit different sort of effects and see different parts of the body and the anatomy and the physiology. So. Sure. So conventional sort of anatomic MRI, what it gives you are T1, T2, and proton density contrasts between the tissues, and those really depend on, again, the interactions of those water protons with its environment. Diffusion MRI uses the protons, which are always moving, within the body that are attached to water molecules. So what we do is we use the spins on those protons to tag and then untag the spins at 2 different times and look at the displacement of individual water molecules, really how it manifests itself in the bulk water pool. And so what we get out of that is an apparent diffusion coefficient, or a rate at which these water molecules are kind of moving around. And that tells us information about the density of the tissues, and it also gives us information if we're using it kind of tuned to a specific technique called diffusion tensor imaging. We measure the diffusion in a bunch of different orientations, and we can elicit fiber track orientation. So water is restricted in diffusion or motion perpendicular to axons or sort of fiber bundles within the brain, and so and it's relatively free along the length of those bundles. So depending on the diffusion characteristics as a function of direction, we can tell what orientations certain nerve paths and things are propagating. Perfusion MRI typically uses some type of contrast agent. There are a variety of types of perfusion MRI. One of them that we use routinely in the brain for cancer is called dynamic susceptibility contrast. And so what we do is we inject relatively high concentration of gadolinium chelate into the blood, and as it passes through the vasculature, it changes the local magnetic properties of the water. And so, and it's proportional to concentration. So what happens is we do a series of dynamic images during injection, and we can see the signal contrast change. We do some mathematics, and we can drive perfusion parameters like blood flow, blood volume, and those type of things. There are other types of perfusion techniques that don't use contrast, like arterial spin labeling. The idea there is that we saturate the nuclear moment of water within the blood in, let's say, the neck, and then we acquire the images as that water is then moved into the brain. So what we can get is information about blood flow, and again, blood volume and things like that. It's a little bit lower resolution, but that's kind of the general principle. Well, I think there's a lot of, so MRI in particular is really flexible in terms of the types of contrast and the types of information you can get out of it. So, like you elicited before, you can get your T1, T2, and proton density contrast, the kind of basic ones, but we can do all kinds of things in terms of diffusion, perfusion. We can excite protons on macromolecules and see how they interact. We can do spectroscopy to see what concentration of different metabolites are in there. So there's a lot of flexibility. So I think the future is going to really hold speeding up MRI acquisition using a variety of techniques like compressed sensing, computer algorithms, as well as novel acquisition techniques. And I don't think it'll ever fully replace the other imaging technologies because they kind of complement each other. Although it has, for the most part, replaced CT in a lot of applications, but there are certain applications certainly where CT has a big advantage, like lung, or if you're imaging things with air or bone, MRI is not particularly useful. So.